Hi, everybody. In the second part of the presentation on the response of the district to the COVID-19 health crisis, I wanted to share a little bit about an analysis of our crisis response and then also talk a little bit about our planning moving forward into fall of 2020. I'll start with an analysis of our crisis response, and after we settled into distance learning and the school closure, we pulled cabinet together virtually to talk about our response and to debrief, and then also to conduct what we called an after-action review, a critique of our response. And we really focused on what led us, what factors contributed to us being successful in our transition to distance learning and handling the school closure. And I'll break this down into 6 big areas that we discussed as a part of that. One was board governance, and I want to tell board members and members of the public that the board governance model really gave us as administrators a clear framework to operate from, clear expectations, but also allowed for agile problem solving during the crisis so that we didn't have to wait for the next board meeting to get approval on something that we needed to take action on that day. And so that board governance model really provided us the fence posts and the guidelines for how to respond and still keep our mission and our vision clear, but also gave us the agility and the flexibility to handle things as they happened in very quick succession. You saw that slide from that Friday, March 13th date, and things happened quickly and we were able to respond quickly. The second area was the district's focus on equity, and that focus really led us to a kids before content messaging around distance learning that really we wanted to be a resource for students. We wanted to make sure that they felt safe and felt cared for and that they had what they needed before we talked about content and learning. And that same focus was also used with staff, and I think really helped our whole community pull together during this time. The third area that I want to mention is our proactive planning. So number one, very proactive planning in terms of the foundations of distance learning being already set. We had one-to-one devices, we had online learning platforms, we had communication strategies, and we had clear systems in place for a lot of what we needed. And in the immediate term, we had proactive planning beginning in February before a lot of people were even talking about COVID-19 and the impact that it could have on schools. So the fact that we were able to order cleaning supplies and hand sanitizer and masks and get a jump on thinking about what distance learning could look like meant that we were so much more prepared on March 13th when we had to act. I would also mention our professional learning community structure with our staff. Because we have been using that model for some time and really pushing on buildings to use that model in order to work on school and district goals, that was able to transition easily into an online virtual format and really keep our teachers connected with one another to ensure that they were teaching similarly in distance learning, that they were collaborating around standards and teaching objectives, and that structure really facilitated connection and learning during our school closure. The next area would be our leadership team. I just can't say enough about the team that we have at the district office and in our buildings. We were able to apply our norms that have been developed over years through our strategic work and relationships to leverage a common understanding and a vision for what we wanted this to look like, and we were able to all work together very well. And I just want to give a really big shout out to our district nurses. We have 2 top-notch district nurses, Debbie and Elizabeth, responded proactively and appropriately during this to keep us all informed and to keep the work moving forward. And they've done an exceptional job. So thank you to Debbie and Elizabeth. As we start thinking forward, I'll share a little bit of information on our scenario planning for fall of 2020 and our school reentry plan. Dr. Sarin has really given us a charge at the school district office and building leaders to prepare for an extended disruption of in-person learning through the first semester of 2020-2021 while maintaining our vision, our mission, and our core values. And so what that means is that while we don't know exactly what the fall of 2020 will bring, we don't know what public health guidelines will be, we don't know what the level of infection in our community will be, we know that we need to prepare for some sort of disruption, some sort of potential continuation of distance learning. And so we're doing that while maintaining our vision, mission, and core values. And what that really looks like is kind of recalibrating our work into three areas: the safety and basic needs of our students, our families, and our staff, effective delivery of our core moral purposes, which is literacy, math, and social emotional learning, and then continuing to operate the district effectively. And so while as we do that, we're also preparing for the potential reopening in fall of 2020. And so the district cabinet leaders, along with health services, our district nurses, will drive that work. And we're really excited to dig into what we've identified as 6 critical component areas of a reopening plan. So Area 1 would be organization and coordination. We have to collect the information we need. We have to know what the guidelines are. We have to know the science behind disease spread and mitigation. And we have to coordinate that all. That will largely be my continued role in this as the district crisis response coordinator. So I'll be working to gather that information and am on a daily basis with partners around the state and around the country. We'll also obviously tackle the health, safety, and well-being of our students, our families, and our staff. We'll have to create new policies and procedures around potentially arrival and dismissal, lunch and recess, visitors to our facilities. Lots of things will need to be impacted, and we'll need to review what that looks like. We'll have to have a plan for communication and continuing our relationships with students, families, staff, and the community. We'll have to plan for student learning and professional learning that's needed in order to reopen in whatever model we need to reopen in. And then finally, we'll have to have school-specific reentry and recovery plans so that each of our buildings has a clear path into the fall so our students can be successful. We've planned to use a work group model. So instead of having one mega committee make all of these decisions, we plan to use a work group model where which will be distributed leadership down to different work groups working on specific topics and specific decisions that need to be made. Those groups would make recommended actions to the leadership team, and then the cabinet together with our health services team would be the ones making final decisions and then pushing that information forward. And that's going to bring us to May, where we started thinking about scenarios and brainstorming. We held our first scenario planning on the 11th of May with our cabinet level leaders, and on the 21st of May with our leadership collaborative. So that's all of our building and department leaders, both on the teaching and learning side and the operations side. And we will work to get additional stakeholder involvement throughout the summer, including through participation on work groups and focus groups and through surveys. So we're really looking to get a wide-ranging opinions and suggestions from our community as we plan for the fall. So if there are any questions, people can definitely reach out to me. My email and contact information is on the school district website. I'll also be happy to answer questions at the June 8th school board meeting about our initial response, which I detailed in part 1, and this proactive planning and analysis of our response, which I discussed here in part 2. Thank you everybody for your time today, and have a great rest of the day.